Welcome to another edition of A New Me. Our guest experts help you learn about the latest medical advances and procedures by providing you with the real information necessary to help you eliminate the dangers of making the wrong medical and cosmetic enhancement decisions. Get ready for your consultation. Coming up, we will be on location in Towson, Maryland, discussing the latest advances in dentistry and how they can help improve your dental health and give you the smile that you've always desired with one of this region's top dentists, Dr. Christopher Toomey. Dr. Toomey received his DDS degree from the University of Maryland Dental School, and he received advanced training and continuing education from the Dawson Academy, William C. Struck Postgraduate School of Dentistry, the Spear Study Group, and Spear Education, along with the Veterans Hospital in Baltimore. He is a member of the American Equilibration Society, among others. Welcome, Dr. Toomey.
Hi, Rocco.
It's a pleasure to have you on our program. It's your first time, in fact, on Top Doctors. We've got a lot to talk about. We've got a patient of yours and her mom that's going to be joining us a bit later as well. But I wanted to begin, Dr. Toomey, if I may, by asking you if you can please tell us about some of the latest advances that have taken place in dentistry.
Well, thanks for having me, Rocco. And these are the things that I really enjoy talking about. There are a lot of advances in dentistry for patients today that make a big difference in their how they're treated. I think it's much more comfortable care that we can give today versus 20, 30 years ago. Biggest advancements that I see in the dental field is that of trying to save tooth structure or remineralizing tooth structure. In the past, we used to do fillings. We used to take a lot of tooth structure away. Today, we're trying to eliminate disease by regenerating or having the tooth regenerate itself, and we are making huge strides in that aspect. Diagnosis is always a big advancement in dentistry, has been in the last 20 years, in the sense that we used to, as you probably are aware, use a pick and a mirror to diagnose a cavity. Today it can be with that, but it can also be with a laser. And if we can pick up disease at an earlier progression, then we have a lot better chance of saving teeth for patients and eliminating the disease earlier on.
So basically, from advancements that have taken place that you just touched on in particular areas, really I would think a big overriding part of that would be the advancements in technology, which has allowed these advancements in dentistry to take place.
Well, so our advancements today in digital x-rays versus the old style x-rays allow us to pick up disease sooner so that we can treat it sooner and eliminate it.
Well, these are certainly major benefits for the patients out there that are going through various ailments. I'm really happy to hear that all this is now available to folks. And you touched on, briefly, you mentioned TMJ, Doctor, and I wanted to ask you if you can please tell us about what that is. What is neuromuscular dentistry?
Sure. TMD is a disorder it's a complex disorder that can involve tooth problems, muscle problems, all the way up to neurological problems. And the typical TMJ problem is where a patient would either suffer from headaches, suffer from muscle spasms, or come in and have none of those symptoms, but may have signs that their teeth are cracked, or they've had a lot of root canals and they're missing a tooth here or there and they don't know why. Well, the biggest advancement I think in dentistry is to find that root problem, and a lot of times it starts at the joint, which is called the TMJ, which is a joint right in front of our ears, and it's how the jaw, the mandible works, and our teeth are set in the mandible.
And what are some treatment options that are available for TMJ problems?
So the first thing we want to do, again, is after diagnosis, is if possible, do what's called a reversible treatment, or a treatment maybe with a night guard, something where we don't change the teeth. We want to get rid of the problem the patient came in with, recreate that problem and then eliminate that problem. And we do that with our night guards. Once we are able to do that, then we can go on to something more non-reversible, such as maybe move teeth with braces or orthodontics. Sometimes I reshape teeth. My goal is that I am trying to get the teeth to work in harmony with the muscles and the joint. And once we're able to do that, sometimes we can eliminate the disorder that the patient came in with.
Very good point, and I find that very interesting because I know a lot of folks out there suffer from this, and it's basically a misalignment that has taken place.
That's 100% right, Rocco.
And everything needs to get put back into harmony, as you mentioned, and that's where this comes in.
That's correct. That's correct.
Now, you mentioned bite guards, Dr. Toomey, and we've heard a lot of different things about them, and I just wanted to ask you, would you say that all bite guards are the same?
Rocco, definitely not. That's a great question. What we are trying to do, again, is treat the disorder. So depending on the problem that you came in with, which might be arthritis, might be trauma, or just simply headaches and muscle soreness and muscle symptoms, each one would require or could require a different style of guard. And many times I'll have patients that come and have had something made in the past, but it has not been adjusted properly. And so it could potentially get them in more trouble or bring about more of these the pains and the symptoms of this disorder. So they're all not the same. That was a good question.
Yeah, because you hear about, for instance, these athletic mouth guards. And what a lot of people don't realize, and we found from our research over time, is that they can actually cause a lot more problems in this particular arena than people realize or are aware of.
That's right. And a lot of the sports medicine and sports arenas are getting into certain mouth guards as they're training athletes. And you're right. And I spoke with one of the major companies about this, that these athletes, we need to make sure that they don't have an underlying problem, because it could really exacerbate it. Or you're also seeing a lot of patients come in with snore or sleep apnea issues, and if they're given the improper guard for that, they could end up worse off with TMJ damage as well as sleep apnea on top.
My goodness. Now, what's the process that a patient would typically experience when it comes to TMJ that you see?
As symptoms?
Yes.
The symptoms typically are, they may come with headaches. They may come with muscle soreness, muscle pain in the facial region, front of the face, behind the ears, top of the head. They may have a soreness in their shoulder. They could also have worn teeth, loose teeth, or missing teeth.
I wanted to ask you, Dr. Toomey, as far as for the folks out there that are watching, they may want to know how long would the treatment for TMJ typically take, and obviously I put in the disclaimer that I'm sure it varies based on each particular patient and his or her situation and what's required and involved, but typically what would somebody be looking at?
Absolutely, Rocco. A typical scenario would be 6 months to a year. Okay. Those with more damage, more years in with the problem, may experience that it takes up to 2 to 3 years of total treatment. We always want to direct that treatment to something reversible and to try to eliminate those symptoms within the first month of treatment. And then from there, once we have the patient comfortable, we can then go and decide what the final course of treatment might be.
That's wonderful, because, and what I love here from what you've told us about related to TMJ problems is these treatment options eliminate TMJ over time. It's not just a Band-Aid, for instance. And we're not talking about something that would persist throughout one's life. These treatments can actually remove this TMJ problem.
Correct. We're trying to make the patient as comfortable as possible and eliminate or stabilize, if damage has occurred, stabilize that damage so more damage does not occur.
Yes. Now, what kind of results can we expect, Dr. Toomey?
We definitely would expect comfort to come within the first month, as I was saying before. Long-term care is needed. Patients would be followed up. Usually, once we get them corrected and comfortable, We then follow them up on a 6-month, which is similar to their dental cleaning.
Yeah, that's
routine.
That's the same routine. You're right,
Yeah,
absolutely.
yeah.
About once every 6 months.
Mhm.
We're now going to meet Lauren, a patient of Dr. Toomey, and her mom. Welcome, Lauren. Welcome, Elaine. It's a pleasure to have you both on with us today.
Thank you.
It's nice to be here.
All right, and I wanted to begin with you, Lauren, because you're the patient
Yes.
of Dr. Toomey in his practice, and Elaine, you're the mom.
Mhm.
And I wanted to begin by asking you, Lauren, if you can please tell us what brought you to the office.
Well, originally I came here because I was having some trouble with my jaw. I couldn't open it all the way. I could only open it about halfway, and it was very painful to do so. I even had some trouble eating. I'd have to cut my food into very small pieces because I couldn't open my mouth all the way to eat. Like, I couldn't eat a sandwich. But I came here and
And Elaine?
Yes, she would have a lot of trouble opening her mouth, and when she did, it would pop. You could actually hear her when we would eat at the dinner table. You could actually hear the popping sound every time she opened her mouth, and it just sounded painful.
Oh my goodness.
Yeah.
So then what happened, ladies? Well, you came here to Dr. Toomey's office, and what took place next?
well, my treatment consisted, I was fit for a bite guard, and I would come back every few weeks to have it adjusted to realign my jaw, I think. And it ended up working out very well.
Oh, that's wonderful. So the bite guard is what the treatment option was
Yes.
in your case.
Yes.
And you basically had that put in, and then how often, like you were mentioning, a few weeks, every couple of weeks?
Every few weeks. And then as the treatment progressed, I would go for longer stretches of time without coming back to the office to have it adjusted.
Wonderful. And Elaine, what have you noticed since
Well, I remember when the first appointment, they measured her opening, and it was her mouth, how wide she could open her mouth, and it was 27 millimeters, which is really small. And they did the bite guard, and we came back, I think, in 2 weeks.
In 2 weeks.
And it was double that, just from wearing, I couldn't believe it, just from wearing the guard for those couple weeks.
My
That big a
goodness.
difference, and the pain started to subside, and the popping started to, it ended.
Decrease.
It almost stopped. Yeah.
So you've got your function back, your bite is, the
It's
radius is
wonderful.
back to what it should have been in the first
Mhm.
place, and now everything is back to normal.
Everything's wonderful. I feel great. I can open my mouth all the way now. I can eat that sandwich, and I feel so much better.
That's wonderful. I'm so happy to hear that, Lauren. Now, for the folks out there watching, Lauren, Elaine, maybe you can begin with you, Lauren. If you can, what would you tell them about Dr. Toomey and his practice?
I love coming here. It's so nice. Everyone's so nice, and it's really great. And I realized by coming here that there really is help. Before, I thought this might be something that I'd have to live with for the rest of my life. I didn't know. I didn't know if there were any treatment options available. But now I know there is help.
That's wonderful. And you're,
And
Elaine?
yeah, and the bite guard, she wondered about wearing that and thinking that it might be uncomfortable, or even Dr. Toomey said, you wouldn't have to wear it to school, but you did wear it to school.
I did.
And it's really not big. You don't even you don't really even notice it when you're wearing it, and it was easy. And she even says it's even comforting sometimes to wear it. So she wore it all the time. She wore it 24/7, except when you ate, right?
Right.
Yeah.
That's great.
So
Yes.
it was easy treatment with big results.
Yes, indeed. And on that note, I'd like to thank you, Lauren, and you as well, Elaine,
Thank
for
you.
joining us and sharing your experiences with us here.
Thank you.
You're welcome.
We're now back with Dr. Toomey. My goodness, Lauren's life has changed. She can now eat a whole sandwich. She doesn't have to cut her food into little pieces anymore. All I can say is that's wonderful, Dr. Toomey.
This is what I really enjoy about dentistry, is being able to change someone's life. And these patients, they come in, they're hurting, and to be able to get them back to the normal, show them what normal should be, is I really enjoy.
And the poor thing, I felt so bad for her when she said that, and she's only 18, and she said that she actually thought before she came to your office, and obviously her problem is now corrected, but she actually thought before coming here that this was a problem that she would have to live with for the rest of her life. And one should never have to experience that or even think that when you're only 18 years old, for God's sake.
That's right.
Now, we've heard a lot about MI-PACE therapy, and that's something that I know that you have a very strong reputation in as well. And I wanted to just ask you if you can please begin by telling us what it is for the viewers out there.
Sure. I became interested and studied a therapy that has been able to remineralize teeth. The therapy, what the typical case is, a child might come out of braces, get their braces off, and notice all of a sudden they have a whole bunch of white spots on their teeth. Or your patients that would have dry mouth and may have decay on a root surface. We wanted to fix that with minimal invasive technique. And this MI therapy is a course of treatment that takes a tooth and strengthens the tooth. The tooth has lost minerals, and that's why these white spots are happening, or the precursor of decay is happening. And what the therapy does is reinfuse the tooth back with calcium phosphate ions, strengthens that tooth, makes it less susceptible to decay. And on a cosmetic end of it, it's an extraordinary result where some of our cases, patients thought they would need veneers, crowns, a more invasive style of dentistry, and turns out, in fact, they did not need any of that. All they needed was the therapy that would remineralize the teeth, and then they can whiten their teeth, and the teeth look beautiful.
Very interesting. Basically, it rejuvenates the teeth.
It rejuvenates the teeth.
With
exactly
natural
right.
Minerals and elements. That's very interesting.
And the problem really came to light when a certain number of patients would begin the whitening process of whitening their teeth, and they would notice their teeth were spotted or spotty. And so instead of just whitening the teeth, now what we do is we remineralize first, as you said, and then once the tooth is uniform in color and strength, then we begin the whitening process. So it's a treatment that can help a vast number of people, all the way from the younger patient, even before braces, when we see the beginning signs of decay. If we can knock it out there, and sometimes this therapy can do that for us, they'll never need a restoration, and that's the goal of dentistry. That's the advancement.
Yes, indeed. That's a huge advancement and a major benefit for many folks out there. It's another option that I'm sure a lot of folks aren't aware of.
That's correct.
Now, how is it performed as far as the process? What's somebody looking at?
So the process, so you would come in for an initial exam, and we would chart for the problem that you're experiencing. The general treatment takes anywhere between 4 to 8 visits. And in each visit, it's a 30 to 45 minute visit where the teeth are cleaned, the material is applied, and then we make trays for the patient to take home, and they'll then do some home care for us at night, and then we will see them every week.
And what type of results can we expect from the MI-PACE therapy?
So the longevity of this is once you remineralize the tooth, you have strengthened the tooth. The results should be long-standing. As long as you eliminate the cause of what demineralized the tooth, and that is another aspect that
sure.
with today, we are in dentistry, in our profession, we're actually seeing dental decay on the rise. And the reason is because a lot of the diet, a lot of the sports drinks, a lot of the things that we ingest or medications tend to demineralize teeth. And all that means is that we're putting an acid next to a tooth, and the tooth is releasing ions to neutralize that acid. So once we get the process complete with the MI therapy, we also want to give good instruction to the patient on what started the event. And the process should last forever. The process should...
Absolutely, in theory it should.
Mm-hmm.
It's like anything. It's weight loss, for an example. When you lose weight, well, guess what? If you eat like you did to become obese in the first place, you're going to get obese. And it's the same thing here. This can rejuvenate, revitalize your teeth, and give you that healthy, younger look that you had. But if you go back to doing whatever caused those problems in the first place, over time, anything would regress as opposed to continuing with those great results. And
Rocco, you bring up a good point. And before even dental school, I think I felt this way. I don't know if patients do. We always thought the tooth was an inanimate object, almost a dead object. It's not. It's a living organism. And it gets weaker over time, and it can strengthen. And that's where dentistry is really advancing, is looking at how do we strengthen teeth instead of constantly take away from a tooth because of the disease. So that's exactly right. So if we can eliminate the source that is weakening the tooth, then we're on to something.
Yes, indeed. We're literally out of time, Dr. Toomey, but before we let you go, I wanted to ask you, you and your practice here in Towson, Maryland, have certainly achieved a reputation for excellence in the field of dentistry and patient care. And I just wanted to ask you, what would you say has helped separate you apart from many of the other dental practices out here?
I think the separating item is I have the best staff that cares about people, and when that happens, that makes it easy to care for people. And I think patients realize that from the time they phone call and then when they walk through the door, that the people that surround me care about these, and they care about the individuals, the patients, and then from there, the take the time to meet with each patient, to individualize the care, find out what is ailing the patient or what the problem is that the patient has. Take your time with the diagnosis. That way I think you can, I then present the best remedy for the problem that they brought to me.
Yes, indeed. Not to mention you're a state-of-the-art office here. Your latest technologies certainly have a wonderful reputation. And Lauren, a patient who we had on a bit earlier, is just one of many folks that you help on a daily basis. And on that note, I'd like to thank you, Dr. Toomey, for joining us, being a guest on our program. I think you really enlightened us and educated us on some major advancements that have taken place in dentistry that can help so many folks out there. Thanks again.
Thanks, Rocco.
It's our pleasure.